So good afternoon, and thank you for joining us. My name is Kayla Rogers, and I'm an Education and Outreach Coordinator for the Women's Fund. For those of you who are not familiar with the Women's Fund, we are a not-for-profit organization located in Houston, and our mission is to provide women and girls with the tools they need to be advocates for their health. We do this through focused seminars like today's presentation, as well as curriculum-based classes and publications. Our presentations and our publications are completely free. I encourage you to visit our website, thewomensfund.org, where you can download PDF versions of our publications or fill out a request form for physical copies. So I am so grateful for our guest speaker today. This is the final presentation for our Nutrition Awareness series, and we are going to be hearing a presentation over building blocks for a healthier you by Dr. Vinita Bhagia. And so a little bit about Dr. Bhagia. She is the Chief of Endocrinology at Kelsey-Seybold Clinic. She earned her Bachelor of Medicine and Bachelor of Surgery degrees in 2001 at Lady Hardinge Medical College in New Delhi, India. She completed her internal medicine residence at the University of Texas Medical Branch at Galveston in 2007, followed by her fellowship in diabetes, endocrinology, and metabolism in 2009 when she served as chief fellow. Over the course of her career, Dr. Bhagia has cared for her patients at the Endocrine and Psychiatry Center in Houston from 2009 to 2011. She also served as endocrinology section chief at the Advocate Illinois Masonic Medical Center from 2011 to 2017, and as an assistant professor of endocrinology at the University of Illinois at Chicago. After relocating back to Houston in 2017, she cared for patients at the Diagnosis Clinic until joining Kelsey-Seybold in 2019. Dr. Bhagia is a member of the American Association of Clinical Endocrinology, the Endocrine Society, the Texas Medical Association, the Association of American Physicians of Indian Origin, and the Indian Doctors Association Houston. She enjoys spending time with her family, especially her two kids, as well as traveling, listening to music, and dancing. So, Dr. Bhagia, we are so excited to have you here today, and I'm going to turn the floor over to you for your presentation.
Awesome. Thank you, Kayla. Appreciate that intro, and thank you for having me here. I'm delighted to be here. Today, we're going to talk about building blocks to a healthier you. Just talking about, nutrition, hormones, talking about some of the building blocks to get you going. And we can start with the next slide. So as I said, today we're going to talk about the metabolic engine. We're going to talk about different building blocks. So we'll spend some good time on nutrition. Then we're going to talk about hormones. What are hormones? What do they control? What do they regulate? Then we'll talk a little bit about blood sugar. So being an endocrinologist, I spend a lot of time dealing with diabetes. And, a lot of times, a lot of blood sugar questions come up. So just giving you basics of what a normal blood sugar should be, what high sugars can cause, what low sugars can cause. And then we'll spend some time talking about thyroid, low thyroid levels, high thyroid levels, thyroid nodules, and what they entail. And we can go to the next slide. All right. So nutrition 101. So food basically is fuel for our bodies, right? So we have pros and cons to every situation. So certain foods can be good for us, but certain foods can be bad for us as well. And so we want you to get, the right balance of food. We want to get the right quality of oil and gas. We all function on fuel. Our car functions on fuels, and we are no different, right? We all function on fuel, and we want to get the quality of oil and gas that you use to run longer on a lesser amount of fuel, so to say. So we want to keep in mind, what a well-balanced diet entails. It gives you the energy to keep you active, and it gives you important nutrients for growth and repair, helping you to stay strong and healthy. Next slide. So what should we eat every day? So I'm going to break it down into, different categories and then talking about, how many servings we should have a day and with some good examples. So as far as vegetables go, we actually talk about 5 servings a day. I know it sounds like a lot and a lot of us skimp on our vegetables, but we want to get about 5 servings a day. And an example of a serving is a whole cup of raw leafy vegetables like excuse me, raw leafy greens like spinach or kale, or it could be half a cup of cut up vegetables, a half a cup of cooked beans or peas, or 1/4 a cup of 100% vegetable juice. Again, we don't want to get processed foods in. We can take a Vitamix, a blender, and make our own vegetable juice, but we want just 1/4 of a cup for a serving. As far as fruits, we want about 4 servings a day. Again, examples being a medium whole fruit, it could be an apple or orange, it could be a pear, versus it could be half a cup of cut up fruit, 1/4 of a cup of 100% fruit juice. Again, we're not proponents of juices, but again, if you take a blender and you put in fresh fruit and you juice it up, again, 1/4 a cup is a good serving. Fruit tends to have a lot of sugar, so we want to kind of not get too much sugar. So 1/4 of a cup of fruit juice or 1/4 of a cup of dried fruit is a good choice as well. Next page. As far as grains, we want 6 servings per day. A grain would be about 15 grams. A grain typically means 1 serving is 15 grams of a carb. Examples could be a slice of bread, 1 small tortilla, a cup of ready to eat cereal. It could be uncooked pasta or rice. We typically say 1 ounce or half a cup of uncooked pasta or rice makes about half a cup of cooked pasta or rice. So that's the serving size, or half a cup of popcorn. As far as dairy goes, we recommend 3 servings a day, which would typically mean a cup of milk, a cup of yogurt, those store-bought small cups of yogurt is a good serving size, or 1.5 ounces of cheese, which is typically like a cheese stick that we typically get, or a slice of cheese would be a good serving. Next slide, please. When we talk about poultry, meat, and eggs, we talk about 8 or 9 servings a week. So that comes up to be about 1 to 2 servings every day. And we try to eat lean and extra lean proteins. We don't want too much fat. So we want to make sure that the skin and any visible fat has been removed. You can ask your butcher to do that, or you can bring it home and do it yourselves with some kitchen scissors. Examples would be 3 ounces of a cooked meat or poultry. And by 3 ounces, we typically show our palm. Our palm typically is 3 ounces. That's the amount of, meat or poultry, which could be chicken, fish, beef, is the right size for each meal. And then we could do 1 whole egg or 2 egg whites, keeping in mind that the yolks have a lot of cholesterol. So if we're eating 2 eggs, we want to skimp on the yolks. We can do 2 egg whites there. Fish and other seafood, we recommend 2 to 3 servings per week. Fish and seafood gives us a lot of good omega, which is definitely very good for us. So again, 3 ounces of a cooked fish or seafood would be a good serving size. Again, the size of our palm. Next slide. We also recommend using nuts, seeds, beans, and legumes in our meals on a daily basis. About 5 servings per week is what is recommended. And we honestly do get a fair amount, at least I get a fair amount of this, but we should make sure we do. Nuts are a great source, eating either 2 tablespoons or half an ounce of nuts or seeds, and seeds could be pumpkin seeds, sesame seeds, sunflower seeds. Peanut butter is another good source. So, just grabbing a tablespoon of peanut butter is a good way of getting some of that nut butter in. Beans or peas, again, are good things to eat on a regular basis, but a serving size should be 1/4 a cup. So not too much, because they do tend to have a fair amount of carbohydrates as well, which goes into our grains category. So we don't want too much there as well. As far as fats and oils, we recommend 3 servings per day, preferably unsaturated. So we want to kind of limit on the bad cholesterol. We only want the good part of it. And so unsaturated options could be a tablespoon of vegetable oil, it could be canola, it could be corn, olive oil, soybean, safflower. All of them are good oils to cook with. If we're using things like margarine, a tablespoon of margarine is an acceptable option. Not doing butter, but margarine, again, cutting out the fat. And when we're looking at mayo, we want a low-fat version, again, cutting out the fat. And with salad dressings, again, we want lighter versions to cut back on fat. And a tablespoon of light salad dressing would be the way to go. Next slide. So we want everyone to eat a variety of foods. We want to do colorful fruits and vegetables. We don't want white. We want colorful fruits and vegetables, and we want whole grains. So whole grains, legumes, lean meats, avoiding the fat, fish, eggs, nuts, seeds. We want everyone to eat a balanced meal, which contains a protein, a starch, and some healthy fat as well. So a lot of times, our diabetic educators talk about a plate method. So we have a plate, we cut it into half. Half of our plate should be full of vegetables. And it could be any kinds of vegetables. It could be a salad, it could be a soup, it could be, sauteed or grilled vegetables, but half of our plate should be full of lots and lots of colorful vegetables. 1/4 of our plate should be our carbs. So it could be, again, it could be all the grains that we talked about. It could be pasta, it could be rice, it could be bread. And then 1/4 of our plate should typically contain our meats or our fish, our protein, our eggs. So 1/4 of the plate should be our protein, so to say. And then we talk about 1 serving size of dairy along with 1 piece of fruit, which would be a good healthy meal every day. The other thing to keep in mind is to keep eating frequently. So we don't want you to go for hours without eating. And I know we all are busy in our lifestyles, but eating frequently is an important thing. We typically kind of digest or metabolize our food within 2 to 3 hours. So we recommend eating every 4 hours or so, even if it's a small snack. And when we talk about snacks, we just don't want to get some carbs. We want to do a balanced snack. So we want to do a carb with a protein. Good examples would be apple with some nut butter, or pita with some hummus, or we could do nuts and some dried fruit as well. So making sure we get a carb along with a protein. Carbs get absorbed very quickly. They kind of spike our sugars, but get out of the system very quickly. However, proteins give us a more sustained release of sugars. So we want to do a carb to get that instant energy, and then we want a protein that kind of keeps us through for the next few hours. We have to balance our food with physical activity as well. So physical activity is very important, and they typically say that we want 2.5 hours of a moderately intense aerobic activity every week, which is about half an hour every 5 days a week, and then 2 hours of strength training, which could be, again, split up. You could do 2 hours a week, you could do 30 minutes 4 days a week, but 2.5 hours of aerobic activity and about 2 hours of a strength training activity every week is the general recommendation. Next slide. And then we definitely recommend eating breakfast every day. All of us often end up skipping breakfast just because we don't have time, but that is definitely a very important meal. It gets us started for the day, jumpstarts our metabolism. And we want a variety of things. We want some high, rich fiber, dense meals, breakfast options, and then we want to make sure we get a variety of things. We get grains, we get fruits, we get nuts, eggs, dairy. So a fair, comprehensive breakfast would be good. Making food choices that are moderate in sugar content. So sugars are definitely very important. Our body needs that glucose to kind of function, but we want to make sure we don't eat things which are very sugary sweet. For example, orange juice, so sugars get into the system very quickly. They can raise our blood sugars very quickly, and that can increase the production of insulin. Insulin's job is to lower sugars. And so if we have a big spike of sugar, our body ends up producing a bunch load of insulin that can drop the sugars. So if we eat foods which are very high in sugars, our sugar numbers just go up and down, and that kind of makes our body go up and down. So the idea is to have more sustained sort of sugar. So whole grains work really well. Using carbs that are less processed works really well, and doing carbs along with a protein works really well. Then the important thing also is where we eat. We don't want to be on the go. We don't want to be eating in the car. We want to eat on the table. We don't want to be sitting in front of the TV or the computer. We don't want to be surfing on our phone while we're eating. We want to avoid distractions, and we want to enjoy our meal. We want to spend some family time. That's one thing I've started doing. My husband and me and our kids, we all sit down together at least for dinner every day, so that we can all sit together. We can talk about our day. We can concentrate on what we're doing, on eating, spend some time to chew our food, and enjoy what we're doing. Next slide. The other thing to keep in mind is, listening to our body. So a lot of times we eat because of emotional needs. I call that emotional hunger. Okay, so we need to kind of differentiate emotional hunger and physical hunger. Physical hunger basically means our body really needs food. It's been over 4 hours, we haven't eaten, and we're actually hungry and we need the food. But that is a hunger that keeps us full. However, emotional hunger often, stress can lead to it, and we end up eating emotionally. I know I go to my bag of Doritos when I'm hungry, and so that's something we kind of want to kind of differentiate, and we want to listen to our body and understand that yes, we're full, but we have emotional needs here, and we don't want to give into that. We don't want to eat unhealthy just because we feel like it, not that our body really needs it. Okay. The other thing is to slow down to eat. A lot of us, again, are busy rushing through our hectic days, and we just end up like gobbling down our food. We don't spend enough time to chew our food and kind of absorb it well. So it takes some time for our body to actually recognize the fact that we've eaten, and it sends a signal to our brain, to our satiety center, to our fullness center, telling us that we're full. It takes about 20 minutes from the time we start eating for that signal to go in. So we don't want to finish up, our food in 5 minutes. There's no emergency to finish our food. We want to sit down, we want to chew our food, and let our body get that good signal, feeling, giving that sense of satisfaction, that sense of fullness, so that we don't keep eating more, even after we've eaten a good portion of food. So chew your food. Next slide. Blood sugar. So, blood sugar, a lot of people often ask me, like, what is a good sugar? What is it supposed to be? So, blood sugar is something that's definitely a key for healthy life, right? So we need to watch sugar intake for everybody, not only for people who have diabetes or who have pre-diabetes, right? Normal sugars, fasting, and this is basically meaning you haven't eaten anything overnight before you eat in the morning, your sugar normally should be anywhere between 80 and 100, okay? If the sugar is higher than 100 in the morning, anywhere between 101 to 125, that's called impaired glucose. And if it's higher than 126 in the morning, that is possibly due to diabetes, okay? After we eat, our sugars definitely get much higher. Normally after eating, we are going into that 200 sort of range, which is fairly high, but typically we recommend not checking the sugar then. If we do want to check a sugar after a meal, we want to typically check it about 2 to 3 hours after we eat. Normally, our sugar should be down to 120 to 140 range. However, if we have an impaired glucose tolerance, meaning our body is not processing or metabolizing our sugars well, our sugar 2 to 3 hours after a meal could be in that 140 to 160 range. So that's that yellow zone there. And if our sugar is over 200, 2 to 3 hours after eating, that's typically in the diabetes range. So that's the red zone. Definitely need to see the doctor and figure out what might be going on. Yeah. As far as symptoms of high blood sugars, they come very slowly. So a lot of times we don't really realize that our sugars are high till we actually check them. But slowly and gradually, once our sugars start getting higher, we start having some signs and symptoms that could be a sign that we need to go visit the doctor. Okay. Next slide. So what are the signs of a high blood sugar? So as I said, initially we don't have too many signs and symptoms, but once blood sugars start getting above 160 or so, what happens is we start peeing or we start urinating out sugars. And so once we start urinating sugars, we notice we are having frequent urination. We're literally peeing out some sugars that can cause some weight loss as well. And once we lose that water, we end up being thirsty. So increased thirst is a common symptom as well. So we drink more and we urinate more, and it's kind of a vicious cycle. That is a big sign that your sugars might be high and you might need to get things checked. The other thing that happens is, it affects our concentration, right? So our body works on sugars, our brain functions on sugars, and it's kind of counterintuitive. Even though our sugars are high, our body doesn't really absorb it, doesn't recognize sugars really well. It's constantly trying to pee out or urinate out the sugar, and our body doesn't work really well. It can also lead to short-term memory issues or long-term memory issues as well. Next slide. Another symptom people see with high blood sugars is blurry vision. So what happens is when sugars get really high, the lens of the eye kind of swells up. It's a process of osmosis. Whenever we have more sugar, sugar gets into the lens and it kind of swells up, and that can lead to blurry vision. This is something temporary. It is usually reversible early on. And once the lens goes back, once sugars are better controlled, our vision does improve. In the long run, we could also have visual changes in people with diabetes called diabetic retinopathy. This is a long-term complication, meaning if somebody has had diabetes or uncontrolled diabetes or high sugars for a long period of time, so we're talking about 5 to 10 years, that could lead to permanent vision loss, which is called diabetic retinopathy, but that's typically not an initial symptom that happens. When sugars are high, we feel very tired. High blood sugar, it slows our circulation. And if our circulation kind of slows down, we're not able to get that good fresh oxygen that gives us energy, and that makes us pretty tired. Additionally, high sugars can also result in inflammation. And the other thing is, when our sugars are high, we're frequently waking up in the night to go pee, and that makes us tired as well. Next slide. So a few words on low blood sugar. So low blood sugar per definition is 70 milligrams or lower, right? So when we were talking about sugar numbers, we were talking about higher numbers, but if the sugar is less than 70, that's called a low sugar. When our sugar is low, we can have a lot of different symptoms. We can feel nervous, anxious, we can feel dizzy, our hands can tremble, we can feel hot and sweaty. A lot of times our body kind of craves food. So hunger is a common symptom of low sugars. Our body doesn't have enough sugars to function, so we can feel weak, we can feel anxious, our heart can beat fast. Those are symptoms of low sugars. And when sugars get even lower, typically in the 30 or 40 range, which is quite dangerous, it can lead to confusion, it can lead to blurring of vision, it can lead to seizures and loss of consciousness as well. Okay, so sugars as low as those 30s or 40s typically don't happen till you have taken extra doses of medication, especially insulin or certain medications called sulfonylureas that our diabetic patients take, things like glipizide, glimepiride, that can cause such low sugars, but usually people don't have such severely low sugars. So if you have diabetes and your sugar is low, the first thing you need to do is get some sugar. You need to get about 15 to 20 grams of carbohydrates. This could be juice, it could be some candy, it could be glucose tablets. Another example I often give people is milk. We all have milk in the fridge. Most of us do. Milk actually has a fair amount of carbohydrates. So getting about 4 to 6 ounces of milk would work. A regular soda would work. Honey works, just granulated sugar works. So anything sugary sweet works, but we don't want to do too much, right? We want a small 4 to 6 ounce serving. We don't want to drink that whole gallon of milk to get our sugars up, or that whole, juice container to get our sugars up, but 15 to 20 grams of carbohydrates is what we need. Now, if you don't have diabetes, you typically shouldn't have low sugars till you've taken certain medications that can lower your sugars. So in that case, we might need to change medications. Versus, we want to find out what else might be causing it. So sometimes we're eating just very processed white foods, like white bread, or drinking like some juice with it. That can spike our sugars really fast. Our body produces a lot of insulin, and then our sugars kind of plummet down. So eating smaller, frequent meals really helps. Lowering processed carbs, just eating more unprocessed or whole grains, along with some protein, which gives us more sustained sugars, often helps prevent those highs and those lows. But for a quick fix, again, 15 grams of carbohydrates in the form of juice or milk, glucose tablets, hard candy does the trick. Next page. Hormones. So talking a little bit about hormones. What are hormones? Hormones are basically molecules. They're produced by the endocrine system, and they send messages to various parts of the body, right? So being an endocrinologist, we deal with a lot of hormones. So insulin is a hormone, and insulin's job is to lower our sugars. If we don't recognize insulin well, that causes diabetes. Thyroid is a hormone, right, which affects different systems and processes in the body, and we'll be talking about that in a little bit. We talk about female hormones, male hormones. We have hormones that affect our bones, causing osteoporosis. We have hormones that control our blood pressure and causing hypertension. So we have a whole variety of hormones that are, sort of designated for special purposes. And these are major players when it comes to our mental and physical health. So if you have a hormone imbalance, you're probably not feeling 100%. Okay. All right, next slide. So, hormone imbalances can be very different, but they have been linked to processed foods as well. There are certain chemicals that can resemble natural hormones, and they can confuse the body, leading to an imbalance. So it's very important not to take unnecessary supplements. So yes, there are certain supplements, say a vitamin D supplement that your doctor recommended is reasonable to take, but I see a lot of people taking a lot of supplements which are available over the counter. A lot of them might not be good for you, right? As I said, they might resemble natural hormones, and they may confuse your body, leading to more problems. So before you start, taking supplements, definitely, touch base with your doctor to see if it's safe for you. Other things that can affect hormonal imbalances could be anxiety and stress. It could be medical issues. It could be a surgical procedure. It could be certain prescription medications that can alter your hormone levels. Sometimes it could be genes. We could be born with it, or we might have a family history. So a lot of these hormonal problems tend to run in families. So knowing a little bit about your family history certainly helps. And a lot of different diseases can affect our hormones as well. Next slide. Natural foods are one of the best ways to reset your internal hormone levels. So we want some good lifestyle changes that eliminate or limit processed foods and incorporate, fresh, healthy, organic foods. We want clean proteins, right? We want to eat cleaner. We want less fat, less processed food. We want, smaller amounts of carbs, more amount of protein, and eating them on a frequent basis. I think that keeps things in check. Physical activity, again, is very important for our hormonal health as well. Exercise definitely reduces our insulin levels and increases insulin sensitivity. So when we talk about diabetes, we talk about something called insulin resistance. Our body just doesn't recognize insulin, and hence our sugars tend to be higher. Exercise makes our body more sensitive to insulin, so that same insulin that our body's producing is recognized better, and it actually helps lower our sugar levels. And exercise also boosts a lot of our hormones that decline with age, especially testosterone or growth hormones. So as we age, testosterone levels and growth hormone levels lower, but exercise helps to kind of keep them up as well. So a combination of resistance training and aerobic training is certainly important for both, but any type of physical activity on a regular basis is beneficial. So I always tell people, see what you like doing. A lot of people don't enjoy just walking on the treadmill or running on the treadmill. So doing something that you enjoy, swimming could be a good activity, which you could do long term, versus doing something fun. Getting a girlfriend and doing some Zumba classes could be a good idea. I mean, I put on Bollywood music and do some dancing with my daughter, and that works out for both of us over this pandemic. I mean, we've done a lot of Bollywood YouTube videos that has helped us keep active. So think what your resources are, what you enjoy doing, and then go with that. So something you want to do on a regular basis, something that you enjoy, that you can do consistently. Next slide. And then talking about our thyroid gland, right? So our thyroid is a gland that sits in our neck. It's a butterfly shaped gland, right? So there's a right side and then there's a left side as well. And the thyroid gland is a very important hormone. It's a very important gland that produces a thyroid hormone, which is very important. It plays a big role in metabolism, growth, and development of the body. It's very important at the very get-go. So right at the time of conception, an embryo needs thyroid hormone for normal congenital development. Low thyroid levels early on in pregnancy can cause low IQ. So very important to have normal thyroid levels in pregnancy. Body functions by releasing a steady amount of thyroid hormone into the bloodstream. Next slide. So the thyroid's main role is in our metabolism. So I always tell people that thyroid is a metabolically active hormone, right? We want the right amount of metabolism. We can have too much of it, or we can have too little of it. We talk about hyperthyroidism, which is too much thyroid hormone. And we also have hypothyroidism, which is too little thyroid hormone. So we definitely need the right amount to regulate our metabolism, because that affects our body's ability to break down food and convert it into energy, right? So the other thing we want to talk about is our pituitary gland. So our pituitary gland is a gland that's the size of a pea, which sits at the base of our brain, and that produces this hormone called the thyroid stimulating hormone. We call it the TSH. This is the hormone, that's the key hormone that stimulates our thyroid in the neck to produce thyroid hormone in the blood. And then when we look at levels, we see if our levels in our blood are normal versus are they high or are they low, and then we categorize this as hyperthyroidism or hypothyroidism. Next slide. A few common disorders regarding the thyroid gland. So one is the word goiter. A lot of people say that my mom had a goiter, but they don't really know what it means. A goiter is basically an enlargement of the thyroid gland. So a lot of times we can have some nodules in our neck, and that can make our thyroid a little bit bigger than normal. Okay, and that's basically called a goiter. Back in the day when we used to have deficiency of iodine, right? That was another reason why our thyroid used to get enlarged, trying to produce more thyroid hormone. That really doesn't exist these days, at least not in the US. I mean, we have iodine in everything we eat. Our salt mostly is iodized, so we get a fair amount of iodine there. A lot of times we have iodine, not a lot of times, a majority of our bread has iodine, our milk has iodine, a lot of foods that we eat on a regular basis have iodine. Other big sources of iodine are seafood and fish. So we get plenty of iodine. So that iodine deficiency is kind of disappeared, and that doesn't lead to goiters, but typically it's more of the nodules or enlargement of the thyroid when our thyroid is not functioning well. The other thing to talk about is hyperthyroidism. So, like I was saying, thyroid is a metabolically active hormone. So, hyperthyroidism, we have too much of this metabolically active hormone, in which everything in our body kind of speeds up. So, we start feeling very hot, our heart rate gets higher, and so our heart starts racing and we start having palpitations. A lot of times we feel anxious, we feel hyperactive, we can have tremors or jitteriness of our hands. We end up eating a lot, but our metabolism speeds up as well. So in spite of eating so much, we're literally losing weight. So our metabolism speeds up and we keep losing weight in spite of eating a fair amount, or actually more so than normal. Um, this is something that needs attention and needs to be treated with the help of medications. But this is what high thyroid levels means, or hyperthyroidism means. Next slide. And then comes hypothyroidism. Hypothyroidism is low thyroid levels. So early in pregnancy, as I said, thyroid hormone is important as well. And if we don't have enough thyroid hormone during, congenital development as a fetus, that is called cretinism. Cretinism, as I was saying, is, pretty unsafe. It can have, mental retardation, low IQs. There can be abnormal bone formation. So very important for a pregnant woman to get her thyroid levels checked, especially if she's on thyroid hormone replacement. Her levels need to be kind of regulated on a regular basis, and her dose needs to be adjusted to make sure we have plenty of thyroid hormone for the development of the baby. As child or adult, we can certainly have low thyroid levels as well, which could be due to a family history quite often. And that situation, everything in our body kind of slows down. So this metabolically active hormone slows down, and so we start feeling cold, we start feeling tired or sluggish, our metabolism slows down, so we start gaining weight in spite of eating very little. So this is the flip opposite of hyperthyroidism, in which we're eating a lot but we're still burning it off and losing weight. On the flip side here, in hypothyroidism, we're just gaining weight constantly in spite of eating less, because our metabolism slows down. This is again a serious situation that needs to be discovered and treated appropriately, but oftentimes it goes unnoticed for years and years before it gets diagnosed. Another common thing is thyroid nodules. So nodules are basically small little lumps or growths in the thyroid, which are actually quite common. In fact, they say about 50% of our population might have a nodule in their thyroid. I tell people nodules are like moles. We all have them. Where did they come from? We really don't know. Are they dangerous? Are they cancerous? Majority of them aren't. Majority of our moles again are benign. They're not cancerous. So the important thing is the size of these nodules and like how big they are. And oftentimes we end up doing ultrasounds of our neck to look at the size and looking at some characteristics, some ultrasound characteristics that we can see, which might have some suspicious cells, suspicious for cancer. So if we see that the thyroid nodule is fairly big, or we see any suspicious signs, on the ultrasound, we often need to do a biopsy, which is basically called a fine needle aspiration, or FNA. So we use very small, thin needles these days. They're pretty much the thickness of the needle we use for blood work. So it's basically putting in a fine needle into that nodule, getting some cells and giving it to the pathology department. They look at the cells under the microscope, and then they're able to tell us, are these benign, meaning not cancerous, or if these are cancerous. If we have cancerous cells, then typically we have to undergo thyroid surgery to remove these nodules, and often the entire thyroid gland itself. But if they're benign, we just monitor them with serial ultrasounds. Okay, so I think I am done with my presentation, and I'm open to questions.
Yes, thank you so much. That was a wonderful presentation, very informative. We're going to open the floor up For questions, we are a smaller group today, so if you are more comfortable with unmuting yourself to ask your question, you can do that, or you can add your question into the chat box. I will get us started with the first question. So in the beginning of your presentation, you spent a good amount of time talking about nutrition and the importance of eating a well-balanced diet to properly fuel our bodies. What are your thoughts on the keto diet, and is this something that can be followed long-term?
Very good question. I answer that question very regularly. So, a keto diet, I personally am not a big fan of. I personally recommend a low carb diet, right? So, eating lesser amount of carbohydrates on a long term basis. Why I don't like a keto diet is basically in a keto diet, we say we want to cut out all carbs, right? So, cutting out all carbs, like cutting out, bread and rice and potatoes are fine. But when we cut out all carbs, we're not getting any dairy, we're not getting any fruit. And I feel all of these are good building blocks for our body, right? We need our dairy for our bones. We need the fruits, which are a good source of vitamins and minerals. And so I feel we are not getting some of those, essential nutrients. Firstly, the other thing is the keto diet so that's the carb part of it. The other thing is keto diets, we end up eating a lot of fat, right? So we have three kind of uh, types of food. We have carbs, we have protein, we have fat. In the keto diet, we're cutting out carbs, we're eating a fair amount of protein, but then we're filling ourselves up with fat. And we end up eating a lot more fat and a lot more saturated fat. So I see people eating spoonfuls of butter, or they're making fat bombs. And I feel that's a lot of cholesterol, and that in the long run can increase the risk of heart disease and stroke. So that cholesterol piece I don't like. So if you are doing a keto diet, I would do a more modified version in which, yes, you do eat fats, but you eat healthier fats. You eat avocados, you eat nuts, you eat coconut oil, but eating, that much of saturated fat might not be good for the body. In the long run, so I've done a keto diet myself here and there, but in the long run, I feel it's a harder diet to sustain because, we all unfortunately love our carbs. And so for us to avoid all carbs at all times long term is a fairly difficult proposition. So just practically speaking, what I recommend is a modified version of a keto diet. So cutting back on carbs, but getting your dairy, getting your fruit in to get those nutrients, cutting back on saturated fats and adding in healthier fats like nuts and avocados is definitely a good idea. And I personally feel, doing a lower carbs, so, having carbs maybe at certain meals or having very small portions of carbs with meals is a more sustainable option long term. Keto diet is honestly one of the most effective diets when somebody is trying to lose weight. It is way more effective than a low carb diet. So if it's a short term proposition, doing a keto diet with some modified versions, as I said, is a reasonable option. But long term, that's not something I necessarily recommend.
Okay, thank you. Yeah, I see a lot about keto diets or people, participating in keto diets. It's very popular online. So it's always good to just kind of, ask someone who would be able to give a good answer.
Sure thing.
The next question, the next question that I have is also around nutrition and diet. So
Mhm.
you spoke about the importance of eating every few hours. Is occasional intermittent fasting okay? And once you return to your regular eating habits, how is that going to impact your metabolism? Oh, right.
So you broke up a little bit, but what I understood is you're asking about an intermittent fasting sort of diet. Is that okay versus eating more frequently?
Yes.
And what was your second part of your question?
And so if you do intermittent fast occasionally, once you go back to your regular eating habits,
Mhm.
how is that going to impact your metabolism?
That's a very good question. So we have a lot of different schools of thought. So, um, the whole idea is our body works on a certain amount of sugar. And so giving it that little fuel, on a frequent basis is typically the way to go. But the point is that that is a good way to kind of maintain your weight, but it's very hard to lose weight. So if losing weight is a more important issue, which a lot of times we are trying to lose weight, then intermittent fasting can help us because it does lower. So once we don't eat for a prolonged period of time, our insulin levels do go lower, and that helps us lose weight. So it could be done something short term to help us lose weight, and then when we can transition back to eating a more sustained. I mean, that's typically a way to kind of maintain um, or regulate your sugar levels over time. Intermittent fasting is something that would help you lose weight, for a shorter period of time. But you can certainly transition back to eating, on a regular basis.
Okay, thank you.
Sure thing.
So next question is, you mentioned these throughout your presentation, but I thought it would be a nice opportunity to kind of lump them in. Could you give us some of the signs and symptoms that someone may notice if they have a hormonal imbalance? Yes, hormonal imbalance.
Like a hormone. So that's a very wide question. So we can have a lot of different hormonal imbalances. I'll have to go over a lot of different hormones. So hormonal imbalance could be something to do with our sugars, right? So if our sugars are off, so insulin being a hormone, that could cause problems. So if our sugars are high, as we talked about, we can have excessive urination, we can have excessive thirst, we can have fatigue, lack of concentration. Low sugars, on the other hand, could cause symptoms where our body is kind of in a state of anxiety, heart beating fast, feeling hot, feeling sweaty. Those would be symptoms of a low sugar, right? Typically, with a low sugar, after we eat, our sugars get higher and we start feeling better. The other hormone we would look at is thyroid, right? So as far as thyroid goes, if we have high thyroid levels, everything in our body speeds up. So we start feeling hot, or we could have a high heart rate, our metabolism speeds up, we start losing weight, and we typically have a higher appetite then. And then we could feel other symptoms. We could have hair loss, we could have nail changes, our gut can kind of speed up, we can have diarrhea, we can have irregular cycles. So those are symptoms of high thyroid. Low thyroid, on the other hand, everything in our body kind of slows down. So we start feeling tired, we're kind of cold, we're kind of sluggish, our metabolism slows down, we start gaining weight in spite of eating lesser amounts, our gut slows down, we start having constipation, we can have irregular cycles, hair loss there as well. Then coming to female hormones. So female hormones certainly are important during our reproductive age group, and then we have a phase that we go through menopause as well. So while we're in the reproductive age group, the biggest sign is regular cycles. We want cycles to come every 28 or 30 days. We want a woman to have vaginal bleeding for about 4 to 5 days. So if that cycle sort of changes, that's a big sign, right? If your cycle doesn't come in on time, it doesn't come in 28 or 30 days, comes later than normal, or it comes sooner than normal, is a situation that needs to be looked into. When a woman is going through menopause, which average age is 50 to 52 years of age, our estrogen levels start going down, and that causes some symptoms. Hot flashes are a very common symptom we talk about. Mood changes can happen. A lot of time women can have vaginal dryness, sort of a depression symptoms can happen. So that's another situation that needs attention. Other things to keep in mind are blood pressure. Blood pressure could be hormonally related as well. We have some adrenal hormones that control our blood pressure. So that's the situation. Adrenal hormones can be checked into. Bones, osteoporosis can have some issues with calcium and parathyroid hormones as well. So a lot of different situations can kind of happen with the hormonal imbalance. So a wide question, but I tried to kind of get on to most of the important topics.
Yes, thank you. I think it helps to know maybe what you should be looking for. A lot of, or some of those signs and symptoms for the different issues overlap or they're similar. So
Yes.
that leads into my next question. Um, if you believe maybe that you have a hormonal imbalance, or maybe you are just experiencing some of these signs and symptoms, can you just provide an overview of maybe labs that like a PCP would check for someone to, or even labs that are routinely checked to assess for some of these things that you talked about, like diabetes or thyroid issues?
Yes, great question. Yes. So I highly recommend seeing your primary care physician once a year for annual physical. I think that's very important. And that's like a basic something that every patient, or I mean, not every patient, I apologize, every person should do. Right. So when a PCP checks labs, I mean, there's basic lab work that includes a lot of hormone checks as well. So in the basic blood work that they do, they often check our glucose levels. So that's our sugar levels. A lot of primary care physicians, they check something called a hemoglobin A1C. That's a 3-month average of our sugars, and we have a normal range for it. We have a pre-diabetic range for it and a diabetic range for it. So after you're a certain age or you have a family history of diabetes, he would typically check that hemoglobin A1C, which is something that we monitor long term, even in our diabetic patients. A thyroid function is typically part of a panel, an annual physical panel as well, to looking at high thyroid levels or low thyroid levels. Then looking at certain things like our hemoglobin, right? So that's our red blood cells. If we don't have enough red blood cells, that could cause anemia. That's also something very important because, for example, if we're having a thyroid problem, that could affect our hemoglobin. If we're having irregular cycles, we're bleeding too often, we're having frequent menstrual cycles, we're bleeding too much, that could cause low hemoglobin due to, losing iron causing anemia. So that's something they check frequently as well. Then checking sodium potassium levels. So some of our adrenal hormones, like I was mentioning, that control our blood pressure affect the sodium and the potassium levels. And so that's something that they check as well. But in the blood work that they do, they also look at, kidney numbers, they look at liver numbers. So certain things like diabetes, if sugars are high over time, they can affect your kidney function, they can affect your liver function. We can have something called fatty liver that we often see in people with diabetes, where because of insulin resistance, we have more fat kind of going into the liver, and that increases liver enzymes. So that's something that they very frequently check as well. I'm just thinking out loud. Cholesterol is another something. Our lipid panel, looking at our cholesterol, is an important thing because, again, thyroid being metabolically active, it can affect our cholesterol metabolism. If our thyroid levels are high, our metabolism would be faster and our cholesterol would look much better than it has in the past. And then on the flip side, if thyroid levels are low, our metabolism would slow down and our cholesterol would look much worse than it has in a long time. So certainly a lot of things that they check kind of gives us an idea. And then they check a urine typically, and that again looks at our sugars. So if our sugars are too high, we literally start peeing or urinating sugar. So that's a sign for potential sign for diabetes that they look at. They look at protein in the urine. So in certain infections that we might have, which could be like a urinary tract infection, we can have protein, versus if diabetes is affecting the kidneys, we see protein in our urine as well. So looking for protein in the urine is a big sign as well. So even though it doesn't look like it's a lot, they do a very comprehensive check, which looks at a lot of different functions in the body, and hormones affect a lot of these functions. So they do a very good thorough job looking at basic stuff. But if anything comes outside the box, then they either refer you out to an endocrinologist versus they add on more lab work and refer you to an endocrinologist.
Awesome. Thank you. That is a great reminder for everyone to go out and make sure that they're getting their annual exams and their labs done.
Yes, most definitely.
Okay, so the final question that I have for you is something that I like to ask each of our guest speakers, and that is for a final piece of advice or the takeaway that you want us to leave this presentation with.
Right. So, a very good question. So I personally say, moderation is the most important thing, right? So I never say never. I never say don't eat this and don't eat that and don't eat this. So we're human beings. We all like food, we're all foodies and we enjoy our food, right? So the idea is portion control. That's what I always tell people. And this could be not only with food, this is in life in general. We want to have a certain amount of everything in our life, eating a variety of foods, but smaller portions. Never, I'm not a big fan of, big drastic. So I don't believe in no carb and no this and no that, right? So I feel everything in proportion is important. Definitely exercising along with it is important. So doing everything in life in proportions. You don't want to do too much of anything, and that will keep you happy and safe.
Thank you. That was great advice.
Awesome.
Okay, well, I want to thank you for a wonderful presentation, a wonderful Q&A session. This has been really great, and I know that our participants on today and also those who are going to be watching this recording are going to be able to take this information and incorporate it into their lives. If you have any questions or comments after watching this presentation, you can always email us at healtheducator@thewomensfund.org. We would love to hear if you think of anything afterwards. That happens to me a lot of the time. I will be sending out a survey link. We would really appreciate if you would take the time to fill out our survey. Let us know how we did, what you liked, what we can improve on, topics that you are interested in as well. And to the left-hand side of the screen, we have our website and our social media handles. Please follow us on the social media sites. We post regularly about upcoming events, and we have a lot of fun and informational posts there as well. Speaking of upcoming events, we have a presentation on the 5th, focusing on the impact of inequity, lead exposure, and toxicity. On the 7th, we have our first presentation for our BIPOC awareness series that will be with MD Anderson over clinical trials. And on the 9th, we have a presentation over coping with racial trauma. So I encourage you to visit our website, register for these presentations and others as well. Dr. Bhagia, I want to thank you again so much for joining us today. We really appreciate it.
Oh, you're very welcome. And thank you so much for having me. And it was a pleasure.
Have a great rest of your day.
You too. Thank you, Kayla.
Bye.
Bye-bye.